External fluid valve, the diagnostic test, as fluid from the abdominal cavity is tested via a figure or parameter. Evaluate the fluid's appearance, cell count, protein level, and biochemistry to uncover the underlying cause of abdominal swelling. Key diagnostic arthrosac serum societies undergoing radiation. Healthcare group. These are best single stand. That was categorized by this calculated by tracking the hepatic fluid albumin level from the serum albumin level. SAAG is more than or equal to 1.1 gram per day. Indicates high pressure ascites, portal hypertension. Common causes include liver cirrhosis, alcoholic hepatitis, or right-sided heart failure. SAAG is less than 1.1 gram per day, indicates non-portal hypertensive causes. Common causes include malignancies, for example, peritoneal carcinomatosis, tuberculosis, or pancreatitis. Total protein. Traditionally, fluid was classified as a transudate protein uh, less than 3.0 gram per day, usually due to systemic disease, or an exudate protein more than 3.0 gram per day, usually due to local inflammation, cancer, or infection. Because it is less reliable than SAAG, total protein is often used as a supplementary marker. Cell count and differential. Normal ascitic fluid contains less than 500 leukocytes per ml and less than 250 polymononuclear leukocytes per ml. A PMN count of more than or equal to 250 cells per microliter is the primary indicator of spontaneous bacterial peritonitis. Microbiology and culture. Bedside inoculation of fluid into blood culture bottles is standard practice if infection is suspected. Specialized tests. Cytology. Microscopic examination to detect malignant or cancer cells. Amylase. Elevated levels often indicate pancreatic ascites or a ruptured pancreatic pseudocyst. Triglycerides. High levels signify chylous ascites, which is caused by the obstruction or disruption of lymphatic vessels. So you can see the cells, malignant cells in the ascitic fluid. The different type of cells and bacteria in the ascitic fluid, microscopic study of cytology. Also in the field of cytology in ascitic fluid. It's important to differentiate Veflar ascites or infection in the ascites or malignancy. Malignant cells are seen in malignancy. Ascitic fluid cytology is the microscopic examination of fluid from your belly. Doctors do this to find the causes of ascites, belly swelling. It is used to look for cancer cells, signs of infection, or inflammation. Fluid is taken using a small needle. How it works? The collection. A doctor cleans your skin. They use prednisone to numb the spot. They put a needle through the belly wall to draw out the fluid. This is called a parasynthesis. The test. Fluid is spun in a machine. The technician puts the leftover cells on a glass slide. They stay in the cells and look at them under a microscope. What it shows? Cancer. It checks for ovarian, stomach, or colon cancer that has spread to the belly. Infection. It looks for bacteria or tuberculosis. Other causes. It checks for liver disease, cirrhosis, or heart problems. Pros and cons. The good. This test is very accurate for confirming cancer if the cells are found. The bad. Sometimes the test misses cancer cells. This is called a false negative. The tumor might be there, but it might not have shed cells into the fluid. So today we have discussed the analysis of ascitic fluid, the cytology, the protein level, and the lipid ascitic fluid. Thank you for patient hearing.